Oh, okay then. Okay. Good evening, everyone. Today, me and my group mates will be presenting HIV and AIDS. The learning outcome for this presentation are state the name and type of pathogen that causes HIV, explain how HIV is transmitted, and discuss the biological, social, and economic factors that need to be considered in the prevention and control of HIV. So, HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immunodeficiency Syndrome. It's important to know how to differentiate between HIV and AIDS. HIV, HIV usually refers to the virus that infects and destroys cells of the body's immune system, while AIDS is a collection of opportunistic diseases associated with immunodeficiency of caused by HIV infection. The pathogen that causes HIV is the human immunodeficiency virus. Sorry. It is described as a retrovirus. Retro linguistically means denoting action that is directed backwards or is reciprocal. This applies to the action of reverse transcribing of its genetic material, RNA, into DNA with the help of enzyme that can be found in retroviruses, reverse transcriptase, which is responsible for converting base sequence in RNA to base sequence in DNA. The virus is made up of several components. The envelope that consists of lipid bilayer and the protein molecule GP120 and GP41, which is important to invade the T cells. Underneath the viral envelope lies the protein matrix and also links to the capsid, the protein capsule that encapsulates the genetic material, RNA, and important enzymes in it, such as protease and reverse transcriptase. So, how HIV invades the immune system? To know how it invades the immune system, we have to know what are the target cells first. The HIV attacks CD4 T lymphocytes. CD4 T lymphocytes are basically lymphocytes that have CD4 glycoprotein that serves as a receptor. And one of the example of the CD4 T lymphocytes is the T helper cell. The CD4 molecule helps the T cells to communicate with other cells of the immune system. For example, the T cells communicate with the antigen presenting cell to find out what pathogen invaded the body. HIV. So I'm going to explain how HIV enters the T cells. The HIV virus has these molecules, protein molecules called GP120, which then binds to this CD4 receptor of the T cells, which then fuse the membrane of the virus and the T cells together which then allows the genetic material to enter the cell. Then the enzyme reverse transcriptase will take place and reverse transcribe the genetic material into DNA, which then will be integrated into the T cells genome. When the T cells become activated, they start transcribing and translating proteins needed for immune response. This then the cells ends up transcribing and translating new HIV virus because of the new integrated HIV DNA, which then replicates more HIV virus, then butts off away from the host T cell, which then invades other T cells. Then slowly the T cells will die because will destroy because because of the because of the virus. Then over time, the number of T cells will decrease up to a point when opportunistic infections are able to infect the body and then leads to AIDS. What are opportunistic infections? So basically, opportunistic infections are infections that are caused by pathogens that take advantage of a host with a weakened immune system. These pathogens usually can be fended off by our immune system by a normal healthy human being body. But because of a weakened immune system caused by the HIV virus, these infections can infect our body and also threaten our lives. A few examples of these infections are tuberculosis and pneumonia. The symptoms and signs of the HIV. The early symptoms of HIV are flu-like symptoms, such as coughing, headaches, fever, and sneezing. As time progresses, more opportunistic infections arise. Then the symptoms of these infections will show to the body. Some of the symptoms, there are several symptoms of HIV that is common for HIV, such as swollen lymph nodes and hairy leukoplakia, which is basically white patches on the tongue. Then as opportunistic infections start invading the body gets sick, and slowly it will develop, the host will develop AIDS, which the host will experience recurring fever, fatigue, rapid weight loss, and diarrhea.
Okay, so now I'm going to explain about transmission of HIV. HIV is a virus that is spread by intimate human contact, and there's no vector, and the virus is unable to survive outside of the body. Thus, the transmission of HIV is only available by exchange of body fluid, and there's only 4 types of body fluid that HIV virus can be found. The first is semen, vaginal fluid, blood, and breast milk. The next, please. Okay, transmission of HIV can be transmitted by unprotected sexual intercourse. This is due to the exchange of body fluid such as semen and vaginal fluid. Example, the initial epidemic in North America and Europe was among the male homosexual who practice anal intercourse and have many sex partners. These two forms of behavior have put them at the risk. The mucus lining of the rectum is not as thick as that of a vagina. Thus, there's less natural lubrication. As a result, the rectal lining is easily damaged during intercourse, and the virus can be passed from a semen to blood. Besides, HIV can also be transmitted from a mother to a baby. Perimental transmission is another word of transmission of HIV from mother to baby. There's 3 ways that an infected mother can pass HIV virus to a baby. First is that pregnancy, the virus will be transmitted from a mother to a fetus across the placenta. And during childbirth, this is a second method. During childbirth, the exchange of blood may cause the virus to be transmitted from a mother to the infant. And the third way is through breastfeeding. As I mentioned earlier, breast milk consists of the virus. Thus, when the infant is consuming the breast milk from the mother, there's a chance that it will be infected for the virus. And the third way of transmission of HIV is through the sharing injecting equipment. This is more common among the drug addictor. This is because that they will be sharing the syringe, and there might be a competent when there's an infected people use the syringe, there will be contaminated blood on the syringe, and when the next person inject into his body, the virus is able to enter and infect the person. And the fourth way is through the blood transfusion and organ transplant. This is more common among a hemophilia person who have a difficulty for blood clotting. Next slide, please. And there's some confusion and misunderstanding for ways of HIV transmit. And I'm going to explain some of it now. First is that we cannot transmit HIV through body contact, such as hugging, shaking hand, unless that there's a infections or a wound on the infected person. And exchange of saliva will not cause transmission of HIV. This is because that the virus doesn't exist in the blood. The virus doesn't exist in the saliva, but only the HIV antibodies exist in the saliva. Thus, when we want to test for HIV, we can use saliva to test for it. And insect bite will not cause transmission of HIV. This is because that HIV is unlike malaria. There's no vector, and the mosquito cannot transmit HIV. Thus, when the mosquito bites an infected person, the blood that in the mosquito does not consist of the virus. And as HIV does not transmit through the airborne, thus sneezing and coughing will not transmit it as well. Next slide, please. And now I'm going to explain about method to diagnose HIV. There's 4 methods, and the first one is rapid point of care. This method is measure the HIV antigen and also HIV antibodies. This test can deliver preliminary result in around 20 minutes. This may require a blood drop from someone's finger, an oral swab from our gums, or a sample of urine. And the second way is about standard point of care. This method only able to detect HIV antibodies. And these are lab-based tests that also known as HIV ELISA. These tests require a blood draw. The results are usually returned within 5 to 10 working days, and is less commonly to use nowadays is because that there's more faster way compared to this standard point of care. And the third one is more convenient, which is the rapid at-home test. This test can be purchased through online or at many retail drugstore. And this is a saliva-based antibody test. This test is less accurate than a point of care test, as this care, but then there's advantage of this test is that it provides privacy to the HIV suspected HIV patient, and also can deliver the result in short time. The last test is about nucleic acid test. These are blood-based tests that detect HIV RNA. But this test is more expensive compared to the rest of the tests. But then this nucleic acid test can detect for HIV earlier than the other form of testing. This may be appropriate if you have a high recent risk or exposed to HIV and experience acute symptoms of early infection. This nucleic acid test has a short form as NAT. This NAT is also used to screen donated blood or test a newborn babies that suspected of having HIV. These results are usually returned within a couple of days and shorter than standard point of care. And for any positive result, it's called a preliminary positive. We require a second confirmation to ensure that the diagnosis is correct. The only exception is that nucleic acid test does not require further confirmation as it's most accurate. And another point of testing HIV is the timing. If you have been exposed to a HIV, there will be a period called the window period when the test cannot deliver an accurate result. This is because that HIV tests generally detect for antibodies and antigens, which you may need to wait until your body has produced enough of these to elicit the positive result. If you test it too early, you may get a false negative result. Even with the nucleic acid test, you need to wait until the virus has replicated to detectable levels. But then these detectable levels can be varied by individual. So most clinics will advise you to test HIV for 1 or 3 weeks before getting a nucleic acid test, or 3 months before getting any other HIV test. Next slide, please. So now I'm going to explain about oral fluid test. This test, for the first step, is that HIV antibodies from oral fluid are collected through the sweat. As the HIV antibody exists in our saliva, thus we can use a sweat to scratch our mouth between our gums, upper lip, and lower. And once the device is inserted into the test, the oral fluid will mix with the liquid and travel up the test tip. This device is just like a pregnancy test. If the C line turns dark, it means that the device is working properly. And when there's no C lines, that means that the result is not accurate. When only C line appears, the T line have doesn't appear. That means that the test is negative. There's no presence of antibodies. But then when there's both lines, C and T lines, the HIV that indicates that HIV antibodies are present, and this indicates the person is a HIV positive and requires a secondary confirmation at the hospital. While this is non-invasive and highly convenient for the person testing. What is invasive? Invasive is that we don't have to cut our body part for tests testing HIV. But then there's disadvantage of this oral fluid test. The performance is slightly poorer when testing oral fluid sample compared to testing blood sample. The key reason of this is because that there's lower quantity of HIV antibodies in our oral fluid than in the blood, especially during the window period. Next slide, please. Now I'm going to roughly explain about the effects of HIV and AIDS. The first effect is economical loss. HIV and AIDS affect people in their 20s and 30s who are most economically productive and sexually active. What does this mean is that when people in their 20s and 30s, they work hard, working more hard for their life and earn more money. But then when they are infected by HIV, this means that their immune system is weakened and there's probability that they fall sick more easier than a normal person. And thus they are unable to focus in their work. And to avoid the transmission of HIV, they cannot carry any sex activities. Expensive drugs will also drain our government funds because government will pay for the drugs for the HIV patient. And the other effects of HIV is that HIV will promote opportunistic infection, like Sam has just mentioned earlier. This is because HIV has weakened our immune system. Next slide, please. Factors that influence HIV and AIDS global distribution. The first is there's no cure for AIDS. Like drug therapies, they only slow down the onset of AIDS and hence prolong their life. Drugs are expensive and there's possibility that the drugs have mild and temporarily to severe and permanent side effect for the consumer. Other than that, there's no vaccine for HIV. This is because that HIV, the virus, often changes its surface protein so that the immune system is hard to recognize it, and there's no antibodies that can kill the virus. There's long incubation period. Like what I said just now, there's a window period. The carrier may be infected for many years and it might transmit to others without knowing that he himself is actually a HIV positive. And HIV infection cannot be detected during early stage when the antibodies are not produced yet. In the low-income and middle-income country, the disease is widespread beyond the high-risk group. This is because that the government is difficult to track or reach the majority of population and organize to test for HIV. That's all for me. Thank you.
And now for treatment of HIV or AIDS, people who are HIV positive will be treated with drugs. Drugs can slow down the onset of AIDS so that HIV positive people may now have a normal life expectancy. The treatment of HIV or AIDS is called highly active antiretroviral therapy, or in short form, HAART. It is a medication regimen typically comprised of a combination of 3 or more drugs, and it consists of 6 drug classes. It usually consists of a combination of 2 nucleoside reverse transcriptase inhibitors, NRTIs, and 1 NNRTI, which is non-nucleoside reverse transcriptase inhibitors, or 1 protease inhibitors or integrase inhibitors. Next slide, please. So this table shows the 6 drug class of HAART. The first drug class is fusion inhibitors, which blocks HIV from fusing with a cell surface. And an example for fusion inhibitors is called enfivertide. The second drug class is nucleoside reverse transcriptase inhibitors, NRTI, which inhibits HIV's reverse transcriptase and prevent HIV from converting from RNA to DNA. The example for NRTI is zidovudine. In the next one is non-nucleoside reverse transcriptase inhibitors, NNRTI, which will interfere with HIV's reverse transcriptase enzyme by binding to an allosteric site of the enzyme. The fourth one is the protease inhibitors, which interfere with HIV's protease inhibitors, which breaks HIV protein chain into parts. And the fifth one is chemokine receptor antagonists, which also called CCR5 antagonists, that will stop HIV from entering uninfected cells by blocking its main entry portal known as CCR5. The examples of CCR5 antagonists is maraviroc. And the last one is integrase inhibitors, which will interfere with HIV's integrase enzyme and prevent it from being incorporated into DNA. The examples of integrase inhibitors are raltegravir. Next slide, please. So this slide shows the mechanism of actions of drugs. The first one from the left side is fusion inhibitors. Fusion inhibitors will block HIV envelope from fusing with the CD4 cells membrane. And the second one is NRTI and NNRTI, which blocks the conversions of HIV RNA to HIV DNA. And the third one is protease inhibitors. So when HIV enters a person's body, it makes copies of itself by inserting its virus DNA into CD4 cells. HIV instructs the CD4 cells to make new HIV proteins and genetic material, which it will use to create more viruses that can target more CD4 cells. So protease will work by interfere with HIV's ability to make new viruses inside the CD4 cells by blocking an enzyme known as protease. When a protease inhibitors block protease, HIV cannot break down its proteins to make new viruses. So HIV cannot multiply and it stops spreading. Next slide, please. So this is, from the left side is CC5 antagonist, which blocks HIV from entering CD4 cells. And the last one, integrase inhibitors, which block the insertions of HIV DNA into CD4 cell DNA. And that's all of my part.
So, all right, okay, so now will be the prevention and control of HIV and AIDS. All right, next slide. Yes, so here are just a few lists of main methods of how to prevent and control HIV. All right, so I have to clarify a bit more that actually prevention is a form of control and vice versa, where control is also a form of prevention. All right, that's the first thing you should know. Okay, so let me just get straight to the point. All right, so first one will be HIV or STD testing. All right, so we know that if you want to get married or go in a relationship or something, it's best, or maybe you want to donate blood, it's best for you to go test yourself. All right, so there are various ways to test yourself, explained earlier. All right, but a quick way to do it will be using self-test kits. All right, so next one, if you really this happens in poor countries. All right, it is autologous blood donation. So autologous blood donation here is actually, you don't really in the countries, right? In poor countries, sometimes we don't really trust their blood banks there. Why? Because in poor countries, they lack healthcare facilities or maybe their healthcare staff is less properly trained. So there are suspicions surrounding their blood banks, right? Because sometimes when we go there and then we get tested for blood, sometimes the blood there is not screened by the healthcare workers. So this is how actually HIV will be transmitted, which is why most oftenly we see that a lot of cases actually happen in the South African continent, right? Because due to their poverty there. So how to prevent this from happening? You can actually go to a hospital and ask them to take your blood and donate to yourself. So it's what autologous blood donation means. It means donating blood to yourself. So you go to the hospital, then you ask them to take your blood and then keep it separate from the blood bank. Okay, so when you need emergency situations, or maybe you need blood for operation, maybe you can ask them to donate your blood to you. Okay, so when it happens, it's called autologous blood transfusion. All right, so next point will be abstinence. And actually I should put this at the first top, but never mind. So abstinence, if you would ask me, is there 100% way of not getting HIV? It would be by abstinence, okay? Because we know abstinence actually means abstaining from sex, okay? HIV is a sexually transmitted infection. So by not having sex at all, you can 100% sure you will not get HIV. You can say that you are someone who has no risk of being exposed to HIV. But in the end, abstinence does not apply to everybody, because most people have sex in their lives, okay? So if when you do or when they do, it's better for them to be monogamous. So mutual monogamy means mono. If you heard of polygamy, poly means many. So mono means one, and mutual actually means shared or common. So when you put it together, mutual monogamy means sticking to only one partner and both parties agreeing to share only each other. All right. So I'm just gonna say directly, you have to be faithful. Okay, be faithful, because this is a way for you to also limit the number of sexual partners you have, because it makes sense, right? When you limit the number of sexual partners you have, you eliminate your risk of getting HIV. Okay. But yes, even HIV positive people want relationships, okay? So these people, they have to undergo treatment, right? Once they test themselves and then they find out they have HIV, they gotta undergo treatment ASAP. Why? It's to control the spreading of and growth of HIV in their body. So as explained earlier by Hui-Min, all right? The treatment includes antiretroviral therapy. This is short, okay? You can also use highly active antiretroviral therapy, but this one I just shortened it. Okay? So yes, not only you can protect yourself, but it's more important for you to protect your partner also, right? Especially if you want to have family or something. Okay, so controlling this situation here, we should do contact tracing. Okay, yes, if you're a drug user and or maybe you been having many partners, you definitely gotta you have to identify who you are actually exposing to. So this should be done by the government. Okay. Moving on. Yes, sex education. This is what everybody needs and everybody should know. Okay. So you should actually choose less risky sexual behaviors. Okay, because we know that HIV is most commonly transmitted through anal sex. And FYI, anal sex has a 16-time greater chance of transmitting HIV compared to vaginal sex, because so for some obvious reasons, right? The anal lining has less mucus on it, and more HIV is found there. So maybe an alternative to this would be oral sex. All right. So yes, no unprotected sex, especially anal. Anal sex is something that you should actually extensively prepare, because most infections happen through anal sex. So when you have anal sex, is a big no-no to have vaginal sex after. That's how people get vaginal infections, right? Because the rectum is, you could say it's dirty. Yes, and if you have vaginal sex after you after you have anal sex, then you don't exchange your condoms, or maybe like that, something like that. So that's how bacteria can spread inside the vaginal lining. Okay, so next one is PrEP and PEP. Can you please go to the slide with the PrEP and PEP? And down somewhere. The next one, please. Yes, so these two. So PrEP here means pre-exposure prophylaxis, and PEP refers to post-exposure prophylaxis. Prophylaxis means to control. So pre means before, post means after. Okay, so when you simplify it, it'll be pre-exposure control. Okay, this is important for me to emphasize that this is only used for HIV, all right? This is not usable for other STDs. And PrEP and PEP are basically pills, all right? They're pills taken by HIV negative individuals. So there are pills, PrEP contains 2 drugs in it and PEP contains 3 drugs in it. Okay, so PrEP is taken before HIV exposure, like when you know you're going to be exposed to HIV, like when you have an HIV positive partner, you know you're definitely going to be exposed, okay? And therefore PrEP is used after emergency situations. So what do I mean by this? So for example, down here you can see single event exposure to HIV. It means like maybe you like get sexually assaulted or something, then you don't know. You have the person you are assaulted by has an unknown HIV status. All right, so you use it during emergencies, okay, when you're not sure. So these 2 are for people who are at risk, all right? So I think the other details you can just go read yourself because it's not really in the syllabus. All right, so can we go back to the slide, please? The before one. Yeah, okay, thank you. So yes, that's what PrEP and PEP is. Okay, next slide. All right, so another way is to use condoms and femidoms. Okay, so yes, this is a way to protect yourself. All right, you have to use them the right way. The word femidom here actually refers to female condoms. All right, female condoms. So for men, the best way is to use latex condoms. Okay, but unfortunately, not all men can use it because some are allergic to latex actually. So when some of them are allergic, they have no choice but to use non-latex ones. So non-latex ones are made from polyurethane, which is basically the same material used to make femidoms. Okay, but then it is not recommended to use a condom and femidom at the same time. So if you're using either one of this, then what you can use is a water-based lubricant, all right? So the reason we're using water-based lubricants is because it doesn't damage the latex condoms. Because they got different types of kind of lubricants. And the other types of lubricants, such as oil-based or petroleum jelly, they actually damage the condom. All right, so yes, okay. If you're a person who do drugs, please don't share needles. Actually, don't inject drugs in the first place. So don't inject drugs, okay? So this is where drug education comes in, all right? People should know that they should not do drugs. All right, so educate the people. And unfortunately, yes, these people, they share needles, okay? They have to share needles because they are poor. They're facing this addiction, and then some of them are poor. So they have no choice but to share needles because they don't have enough money to buy new needles. Because a new needle is better than a clean needle, okay? A clean needle. So they just use bleach to sterilize their needles. But it's good because they should only use sterile drug injection equipment. So next one, this is also for in poorer countries, all right? They should be having strict hospital policies. Again, as I mentioned before, the reason that HIV is so easily spread there is because the medical staff, the level of awareness is not there yet, or the medical staff has lack of proper training, and then they don't know how to use the equipments, or the equipments are actually not available. So they got to comply to some strict hospital policies for the safety of their people, all right? And then they also have to obey safety guidelines for themselves also, because accidents actually do happen. When a healthcare medical worker is handling a HIV positive person, sometimes there have been accidents where they were using the needle and injecting the blood, taking the blood from the HIV positive person, and mistakes happen. For example, they dropped the syringe and then inject onto their leg or something. So then they're exposed to that blood. So they may get HIV. Okay, so I think that's it for this one. Oh yeah, here's the picture of the test kit. All right, it's also shown earlier before. This is from the textbook. And here, below here is the condom. Up here is a condom, and down there is a femidom. The femidom is bigger. Okay, and here is also the, yeah, and the next slide, the next picture. Next picture is the, sorry, before the next picture, the Truvada picture, yeah. Before that, the PrEP, before that, yeah, this one, down there, Truvada there. That is the picture of PrEP. We have two types of PrEP medicine, it's Truvada and Descovy. This is just one of them. This is approved for global use. Okay, next one. Right, so now is how to prevent mother-to-child transmission, vertical transmission. So this is a simple brochure. You just read this, but it's not that detailed. Okay, this is just to highlight the key points. All right, so next slide, please. Yes, so this is what you actually need to know. Okay, so just like family planning, you have to plan everything before you have children. Maybe you and your partner are HIV positive, or maybe one of you are HIV positive. So let's say, for example, the mother is HIV positive, okay? So yes, the father has to do PrEP, okay? And the mother, she has to undergo treatment and take her medicine as soon as possible. So yes, the treatment is HAART, heart, all right? She has to take it from the beginning until the end, and even after, okay, after having a child. So the father has to do PrEP so that he also won't get HIV. Okay, he has to take these pills every day. So for the mother, when she takes ART, she can reduce the transmission risk from previously it would be 30 to 25% to only 1%, okay, to a child. So her child will be at no risk. Okay, so this has to be followed up closely. So there have also been like questions about C-section here. So C-section is actually said, it can actually help to prevent HIV transmission during childbirth, okay? But this is after you consult your healthcare provider and only when you have an undetectable viral load. So undetectable viral load is when you finish all your courses and your treatment, and then you, the virus is not significant in numbers in your body. So it's called so-called undetectable. All right, so this may pose a smaller risk of passing HIV. So the mother, sadly for the mother, she also can't breastfeed after having a child. She has to use infant formulas and baby milk. All right, it can be found in shops in developed countries. So, but in poorer countries, they might not have this, so they have to breastfeed their child. So if they do, then they have to be 100% adhered to the drugs, have to do the treatment 100%, right? So as to, until her healthcare provider says, okay, you can breastfeed, because I think it's quite safe. So when the baby is also born, they also have to be treated as well. We have to take extra precautionary measures. All right, so preferably after, within 6 hours after birth, he should be tested, the baby should be tested and be given corresponding treatment, which also includes ART, all right, HART, highly active antiretroviral therapy. So 4 to 6 weeks after conceiving. So I think that's all. That's all for me, I guess.
Okay, so this is the summary of HIV and AIDS. Okay, HIV and AIDS are all from a virus called HIV, which is the human immunodeficiency virus. It is a retrovirus which its genetic material, RNA, is converted into DNA in host cells. And also HIV infects and destroys the T helper lymphocyte cells. And HIV can be transmitted through intimate human contact, which is the direct exchange of body fluids. An example of body fluids are blood, semen, vagina fluids, and breast milk. And the transmission can be done by this: sexual intercourse, blood donation, sharing needles by intravenous drug users, mother to fetus across placenta, and mother to infant in breast milk. And this transmission can be prevented and controlled by using condoms, femidoms, and dental dams for oral sex and during sexual intercourse. And these condoms, femidoms, and dental dams act as barrier between the body fluids, and also blood screening to kill HIV for the blood donated, and also donate own blood before operation, like SHARMAINE as mentioned, for blood donation, and also use sterile needles for the injecting drug users, and also not to breastfeed. So HIV can be transmitted from one person to another person, and if the person is infected, there are two types, which is not have symptoms until years later, and also have flu-like symptoms for several weeks after infection. So HIV can be HIV infections can opportunistically develop to AIDS, and also there are two more types of opportunistic infection which cause AIDS, which is the oral thrush caused by Candida albicans, and also the rare form of pneumonia caused by pneumonia xyrovasii. And also AIDS will cause immune system to collapse. Therefore, immune system will be less effective in finding and destroying cancers. So people infected by AIDS may have rare form of skin cancer, which is the Kaposi sarcoma, and also the cancer of internal organs. And the person also may have dementia, which is the degenerative disease of brain, leading to impaired memory, thinking, and communication, and also fever, diarrhea, sweating, and weight loss. So how HIV and AIDS can be treated? For now, currently, no cure for AIDS and so no cure for HIV, no vaccine for HIV. So AIDS and HIV can only be controlled and slowed down by drug therapy, but drug is very expensive and have mild to severe side effects. And also why there are no vaccine for HIV, it's because of HIV often changes its surface protein and hard for immune system to recognize it. So drug therapy, there are a few drug classes and mechanism of drug, and I will only say the name of the drugs because Hui Min has already explained. So there are fusion inhibitors, nucleoside and non-nucleoside, reverse transcriptase inhibitors, and protease inhibitors, CCR5 antagonists, and integrase inhibitors. So next slide. Okay, this is the past year question of February-March 2020, paper 22, question 5. A person with HIV/AIDS has a weakened immune system. This is because HIV infects cells of the immune system, in particular the T helper lymphocytes, T helper cells. The pathogen can remain inactive within host cells. In some people, the pathogen becomes active and causes the number of T helper cells to decrease. And antiretroviral therapy, ART, is used to treat people who are infected with HIV. ART aims to keep the number of T helper cells at a healthy level. So explain why it is important that ART maintains a healthy number of T helper cells in a person living with HIV. This question is actually mixed with chapter 11, immunity. As we learn, T helper cells acts as a manager of the immune system, and it secretes cytokine, which will stimulate the humoral response and stimulate the B lymphocytes to divide into plasma cells and memory cells, and also stimulates the T cytotoxin and T killer cells. So an ART is a drug treatment which will prevent the RNA of HIV from converting into DNA in host cells. So if we doesn't have ART treatment, T helper cells number will decrease. So if the T helper cell number is low, this will increase the risk of developing an infectious disease, and also will lower the level of cytokine secreted. So if the cytokine level is low, this will cause lower concentration of antibodies secreted, and also fewer infected cells are killed, and more time for the HIV pathogen to reproduce and spread, also fewer memory cells to fight for future infection. So next slide. The second question is, it is recommended that ART is given to all people living with HIV. Some countries that support this recommendation find it difficult to provide ART to everyone living with HIV. Other than the high cost of treatment, suggest 2 reasons why it is difficult to provide ART to everyone living with HIV. So it's because of their lack of trained personnel to deliver the treatment, and also some people are willing to take treatment, as drug treatment may have mild to severe side effect, and also for isolated areas are difficult to get treatment to the people who are infected with HIV, and also inability to produce enough drugs, And also not all people living with HIV know they have been diagnosed. Yeah, so next slide. This is a question from October-November 2018, paper 22, question 4B. So this is the question, and I'll straight to B. In 2010, the World Health Organization published recommendation for the treatment of pregnant women living with HIV. This includes both HIV positive women and women who have developed HIV or AIDS. The publication recommended that all pregnant and breastfeeding women living with HIV should be provided with ART. So next slide. Suggest and explain the global importance of providing ART to all pregnant and breastfeeding women living with HIV. As already explained just now, HIV can be transmitted from mother to child. So can be transmitted from mother to fetus through the placenta, and so mother to infant through breast milk. So if we provide ART to breastfeeding women, the child may be protected and reduce the risk of getting HIV, and also the woman will be, HIV of the woman may be controlled, and also reduce the risk of opportunistically develop into AIDS. So this is the answer. Okay, I'll finish my part. I'll pass the presentation to SAMIR.
Okay, so we have a couple of videos to watch.